This is pretty similar to how we do it in real life.
I think the tool is a really fun way to engage with this information.
It's very slick. Like I'm a big fan of like drop down.
So it kind of gamifies it, and I'm very big into making this a little bit more fun.
My name is Ramon Brown.
I am Om Patel.
I'm a third-year medical student at Mount Sinai.
7th year MD PhD at the Icahn School of Medicine at Mount Sinai.
I'm here to try out the new clinical reasoning module.
Guess let's get started with this case, transient loss of consciousness.
So I recently had a patient who came in with complaints of headaches, so I want to go through the case mode and see if I can sort of iterate based off of that. Hi, Ms. Doyle. My name is Ramon Brown, and I'm a third-year medical student. What brings you in today?
I've been having a really bad headache.
What usually makes these headaches worse?
They seem worse near my period or after eating chocolate.
How are you feeling today?
I passed out suddenly earlier today.
Can you tell me more about what happened?
I was walking down the street with my husband.
Have you ever had trouble breathing before?
No.
Can you describe the pain?
It was sharp and got worse when I breathed in.
Are you taking any other medications?
Just a multivitamin daily.
Are you experiencing any like visual signs, things like aura or like rings in your eyes when these headaches happen?
Yes, I see bright wiggling lights before the headache starts.
So I'm clicking about her physical exam. I just want to see general appearance. Okay, she seems to be generally fine. Respiratory rate of 20, so slightly elevated. Her temperature's normal, so it's probably not an infectious process. All right, so I certainly see a lot of options for physical exam. I can do, HENT, neck, chest. So the fact that she had chest pain probably leads me down to the fact this might be a pulmonary embolism. Yeah, this is really helpful now to go back and forth. So let's see, positive D-dimer, that's normal and healthy. Otherwise, she's taking estrogen and then to the CT angio.
I'm selecting our cluster migraine intention for differential. All right, confidence level high, using the light ring and just do like a basic eye exam. This is the illness script. So just going through all of the subfields and sort of like seeing like, hey, based off what the patient's complaining of, like what sort of things, what should I be sort of looking out for? This is a good self-check to make sure, hey, like don't miss the bread and butter stuff.
I think it helps like provide a nice framework for what I should be thinking about.
It's like very user-friendly, which is always a big plus.
Yeah, I like this like homepage that we have here that it's clean, easy to look at. I like that as soon as you look straight in the middle, there's the main question that I need to be addressing. And the color coordination here is very satisfying.
Case mode is very helpful. I like that these are drop downs. I think that's very, very helpful. This is a great way to test your knowledge as well as see like what are the buzzwords that the test writers are going to be.
I think it was actually far more productive for me to be flipping back and forth between the two. I actually think I learned more that way. And it probably cut down on how long I took to finish it.
You spend a lot less time sort of like thinking and wondering like maybe what should I do?
Everything I would need to know and would want to know for both step 1, pre-clinical years, and step 2, 3, like clinical year things, I think it's all here in this tool.
This is a great way to make sure that you're doing a good job of it the first time, the next time, and every time after that.
I think I could use it pretty frequently.
If you want to crush step 2 or crush your shelves, this is definitely the tool to buy.